Well, good afternoon. This is Mike Hill with Coldbrook Insurance, and I'd like to welcome you today to our session on increasing access to care and how you can use virtual physical therapy to improve the outcomes and reduce cost for your health plan and for your employees. As we dive in, I'd just like to give you a little overview of what we're hoping to accomplish today. So Coldbrook Insurance Group and Total Control Health Plans are focused on helping employers design and implement the best custom health plan for their company and their employees. And what we call those plans are total control health plans, and they leverage creative and flexible solutions to help employees get the best possible care as easily and cost effectively as possible. One of the side effects of the coronavirus is that virtual healthcare has gone mainstream, and we don't expect that trend to change anytime soon. People are meeting with their primary care physicians and specialists virtually, and it's become the norm, and physical therapy is just another example of where we can leverage virtual medicine to help people get the best possible care. Physical therapy is oftentimes an underrated aspect of a health plan, and it's one of the most impactful and useful tools to provide access to employees to help them avoid unnecessary surgeries and unnecessary pain. And it's the place that we think people should start before they consider going under the knife. Virtual physical therapy is something that your plan participants can leverage now while they're stuck at home. But once the lockdown has been lifted, we still think virtual physical therapy is something that health plans are really going to want to leverage to help employees get the best possible care and also to help your plan run as efficiently as possible. And this is why we're excited today to give you a little bit more background on our partner that we're doing this webinar with, ATI Physical Therapy. And just to drive home the point of how impactful physical therapy is, I'd like to give you an example of a fictitious employee by the name of Rick. Rick could very easily work for your company. He's 44 years old. He's been involved in manual labor in one form or another since he was 18, married with 2 kids, and also loves to coach his kids' soccer team. He enjoys working in his yard, playing softball, and he's been struggling with low back pain for the last couple of years. The most recently, though, he was helping a friend move, and while lifting heavy furniture, threw out his back. And now he's unable to come to work, not able to work in his yard and enjoy the things that brings him happiness, and absolutely not able to coach his son's soccer team. So what is Rick going to do? If Rick doesn't have the right health plan with the right coaches to get him engaged and get him to the right care, it's likely that Rick's going to end up at the emergency room. And the price tag for going to the emergency room is going to be about $3,100. And they're going to refer him when the weekend is over to get an orthopedic visit. And that's going to cost about $230. And you know what? The orthopedist is likely going to order an MRI as well. So now the price tag for Rick and the health plan's up to $5,600. After all that process has been done, he's going to have a follow-up visit with his orthopedist, and ultimately, he's likely going to be prescribed 10 visits of physical therapy to help him get back in action. And so the question we like to ask, and our friends at ATI Physical Therapy like to ask, is why not start this physical therapy first? If we've got the right plan designed and the right coaches alongside Rick helping him get the right care, it's likely he would end up at physical therapy first. And we want to make sure that we've got the right partners with the plan to do that. That's why we're excited today to partner with ATI Physical Therapy. Just to give you some background on who they are, they're a national organization with over 7,500 employees in 850 locations in 36 states. One of the key things that we want to share with you today is that it's likely that many of you with Blue Cross Blue Shield or some other commercial insurance companies may have access to ATI Physical Therapy locations through your network today. But some of you may not. And one of the key things about ATI is they also are willing to direct contract with employers so that you can have access to their providers in a fully transparent way, and you can design your health plan to leverage the tools and resources that ATI brings to the table. So I'm excited to turn it over to our panelist and our leader today, Brett Windsor with ATI Physical Therapy. And he's going to give a little bit more background on who ATI is, but most importantly, their new virtual physical therapy program that they've fast-tracked in the event or with the coronavirus crisis that we're dealing right now. And so with that, Brett, I'm going to turn it over to you.
Great. Thanks, Mike. Certainly appreciate the introduction there and appreciate the time today. And Yeah, excited to talk about, I think, something that's popped up here now because of the coronavirus issues, but certainly I think something that's going to be around with us for a long time. So I'm going to introduce you specifically the ATI Connect program right now, which is ATI's version of telephysical therapy, which is another version of telemedicine and telehealth. A lot of names going around right now. We've chosen to brand this as ATI Connect because we really do just feel that this is a great way to connect with our patients. As said, my name is Brett Windsor, and I'm responsible for the beginning of the Clinical Excellence Program at ATI. And that Clinical Excellence Program was largely formed in an effort to try and reduce some of the variability that we see in physical therapy, because we do know that physical therapy is a high-value, low-cost argument. There is a lot of literature out there now showing that physical therapy is effective, and it's particularly effective when it's used first, just speaking to Mike's original points there. It is low cost, it is low risk, it's conservative, and can often result in early outcomes being produced, which allow the person to get back to work and also get back to their roles in their daily lives. ATI has been very successful over the last, particularly last couple of years within the industry. Our outcomes in terms of producing clinical outcomes and clinical functional efforts with regards to the neck, back, shoulder, and knee, which are responsible for 80% of the patients that we see, are at or above industry standards when compared to the national benchmarking industry, which was reproduced September last year. Not only that, but a lot of good work that ATI has done now using the PT First program shows that we've been able to, through use of ATI First, decrease imaging costs by up to 50% and medications by up to 52%. And when you get to the opioid class of medications, it's significantly higher than that. So this idea that PT First as an initiative can defray musculoskeletal costs is certainly true. And that's with the in-clinic product that we've been using up to this point. And when you look at the overall cost decreases, you can be looking at up to $1,500 per member per year, which is not an insignificant number in today's healthcare world. Traditionally, ATI has been all bricks and mortar. We've got about 900 clinics spread across the country now in 25 states, and we're in approximately 38 separate and distinct regional markets. But it's become increasingly clear over time, and certainly now is a great example of that, is that we have to reach our patients in new ways. The idea that a patient is going to come to a physical clinic 2 to 3 times a week in some cases with today's busy lives and schedules and geographic distances and work really isn't as feasible as it once was, and especially with the technology coming along, and we've found that we've been able to do things in a different way. So the ATI Connect way allows us to connect with these same patients in the same way with the technological platforms that allow us to extend a high level quality care environment to all the patients that we see. So the ATI Connect product, really what we're looking at is for the right care, and Mike hit on this in his introduction. Physical therapy alone can resolve over 70% of musculoskeletal disorders. The remainder of those 30% can be either picked up at the time of initial evaluation, where it can be triaged to the appropriate provider, whether it be a primary care practitioner or an orthopedic surgeon or a conservative sports medicine specialist, or if the patient's not progressing within the first 2 to 3 visits, the patient can then be triaged there, so we can make sure that the right care is provided. Just as important is to make sure we get the care at the right time. One of the interesting aspects about most patients with musculoskeletal problems is that they typically will not seek care until it prevents them from doing something that they want to do. Being able to reduce barriers to care and offer low-cost conservative care that's readily available to patients on their schedule allows them to choose care earlier than they normally would have, which is on its own a significant factor in defraying costs. The right provider is also key, and that's not just when we're looking at physical therapy versus primary care versus orthopedic surgery, but it's also the right physical therapist. Because of ATI's intensive efforts to collect outcomes, we want to make sure that if a patient presents with a shoulder injury, that we can get not only a PT, but the best PT in terms of their ability to perform outcomes in front of that patient so that we can drive the absolute best results possible. And of course, there's also this idea that we want to provide care at a fair cost. Healthcare costs have been increasing too much for too long across too many sectors of society, and ATI wants to be a genuine partner in trying to drive those costs down so that everybody can redeploy their finances in the areas where they want them to and where they can be most effective. One of the questions I get asked a lot is, can a tele-PT visit be just as effective as a non-tele-PT visit? Can we get that same interaction with what we could in the clinic? And my answer to that, as a physical therapist myself of over 25 years, the two most important tools the therapist has are the eyes and the ears, both of which can be deployed very well through the tele-PT platform. Being able to watch a patient move, watch their qualitative movements, watch their willingness to move, watch how far they want to move, and then being able to measure their movement and observe their movement through the video lens is not much different than being able to do it real life. It also forces us to listen more closely to the patient, be much more economical with our words, and much more focused on what the patient is actually saying to us. The other point I want to make is I believe that tele-PT and the ATI Connect product is here to stay. It is definitely true that the coronavirus issue has accelerated our plans to do this, but I do want to point out that we've been engaged in a fairly intense process over the last 12 to 18 months to vet these products with the idea of introducing this platform into specifically our employer, our ability to directly contract with employers. So over the last 12 to 18 months, we've vetted virtually every provider out there, and we settled on a group called Physio, who we believe met most of our criteria, and they've allowed us to very quickly ramp up. And why that's significant now is because this isn't a social media platform. It's not a FaceTime. It's not a Google Hangout. It's not a Microsoft Teams or a Twitter video feed or a WhatsApp feed. This is a legitimate standalone healthcare product that's tightly integrated with our EMR product and as well as our billing platforms and contracting platforms. This slide just, it's a busy slide, but want to make the point here that having this program here does not defray what we see as our responsibility to make sure that we provide the best possible care to the patient. Screening is of the utmost importance to make sure initially that the patients that we're seeing belong in physical therapy, and that they're in the right care with getting the right treatment, and we can get them triaged out if they need to. We're also not in the medical diagnostics game, but we will apply specific physical criteria to the patients that then allow us to guide the treatment through best practice documents, care guidelines. They're evidence-based off the literature, our professional association, but most of all, they're based off 2.2 million individual patient care episodes that we've got. So we have a very good understanding of the parameters of care most likely to be successful with a patient, which makes it much easier to deploy this kind of a product. I want to talk just a little bit about how we select patients for tele-PT. It's very easy just to say that everybody qualifies or everybody doesn't, or to make decisions on who comes to PT based on relatively arbitrary characteristics. At the end of the day, what everything's about is participation. Every individual human being has the ability and the desire to participate in largely two roles. There's a personal side, a family side, a recreational side, and then there's a work side. And there's a certain number of things that we have to be able to do successfully, from the impairment level, which would be we have to be able to bend a knee to squat, to the activity level where squatting may be involved to pick up a box, but also to the overall participation level where those individual components make up the larger part of our job requirements. So two of the things, for instance, that we have to be able to do is we have to be able to fully extend, and we have to be able to fully flex. And a lot of PT is aimed at restoring and making sure that the body has the ability to do those two things on a full-time basis. Now, it's easy enough to measure joint range of motion. It's easy enough to measure strength. But what we also have to do is you have to be able to translate these small gains in range of motion and strength into an overall functional outcome. That is, we have to measure the ability that the patient has to fully participate in the job or personal characteristic that they want to perform. So we collect patient-reported outcomes on every patient we see, and we also include that in our telehealth platform. One of the patient-reported outcomes that we use is the SANE, which is a single assessment numerical evaluator, which simply allows us to ask a patient one question on a scale of 0 to 100 on how they're feeling. If they're feeling terrible, it's a 0. If they're feeling absolutely perfect and able to do everything, it's 100. And these are the things which provide the basis for us to be able to triage patients into either the clinic system or the tele-PT system. So we break up our patients essentially on presentation into 3 separate buckets. And the first bucket, as you can see here, this gentleman's in quite a lot of pain. And this first bucket of patients has high pain. They tend to have continuous night and rest pain. They tend to have pain before the end of their range of motion. And if you think about that pain before the end of range of motion, there's two types of range of motions you'll see here with the active and passive. If you were simply to just take your wrist and bend it backwards until it stops, that's what we call your active range of motion. If you were then to place your other hand on top of that hand and push it back even further, you'll see that the hand has a little bit more ability to bend backwards at the wrist. That's passive motion. Healthy joints have active range of motion, but then they also have a little bit of overplay in the joint to get to full range. In patients who are acutely injured, they tend to active range of motion stops before the end, which is an indicator of a relatively acute disorder. Their patient-reported outcomes generally typically are below 60. So this represents the most acute, most severe of our patients, and they typically are able to, they're not able to participate fully in their work or their home functions. These patients we recommend come to the clinic. And the reason for that is simple. If they don't have the ability to get through a relatively normal range of motion and they have some continuous or constant pain indicative of inflammation, they need different treatments before they can progress to a full exercise program. The second bucket are patients who are in slightly different places. Their pain's lower, it's intermittent. Intermittent pain is a really significant thing. Intermittent pain tends to mean that there's not inflammatory status. Inflammation doesn't turn on and off, it's either there or it's not. And the presence of intermittent pain, and that just means mechanical pain, you move it, it hurts, you stop moving, it goes away, is a fairly good indicator that the patient's going to respond well to mechanical therapy, whether that be manual therapy or exercise. They have pain towards the end of the range of motion, which is also significant because it opens up the possibility that they'll be able to exercise more aggressively. And their active range of motion and passive range of motion are about the same. So there's a little bit of pain at the end of range, but it's not significant. They're only moderately disabled, and their SANE scores tend to be a little bit higher in that moderate range. They're usually at work, they're usually participating at home, and they're greater than 50%. And these patients kind of fall into either one of the buckets. So this can obviously be a lot of geographical issues. It can be risk status for something such as the coronavirus, or it could just be patient preference or employer preference for that matter. The third bucket of patients, and probably the ones that are most applicable to the e-visit setup, is patients with low pain, less than 3 or 4 out of 10, no night pain or rest pain. They have minimal pain at the end of range of motion. Their passive range of motion is great, yet they have the ability to push that wrist back a little bit further. Their SANE scores are more than 74%, and they're able to participate pretty fully in their home or work functions. These patients usually are very much prime for an e-visit. We can screen them on the tele-PT platform. We can give them an effective, individualized, progressed home exercise program, and then the patient can check back in with us and usually get a very good outcome in a relatively low period of time without having to come into the clinic.
Brett, question for you.
Yes.
One of the things that we'll talk about as a more of an immediate need, there may be some individuals who work for some of the employers we're talking to today who had been on a regular PT regimen but now haven't been able to go. Could somebody initially start with an inpatient or in-person visits, whether with ATI or someone else, and transition to your program?
Yes, that's actually how we started the platform. Our first foray into the platform was to take on existing patients, whether they be within our system or other systems. Obviously, if they're coming in from other systems with no history from ATI, we still will do an evaluation, but that evaluation can occur through the tele-PT platform, and then their care can be resumed within our guideline basis. Okay, so let's look a little bit at exactly how the program itself works. And one of the things I do want to mention is that right now we're still doing all of these visits from the clinic. We strongly believe that the professional atmosphere of the clinic and the ability of the clinician to have access to our network, which is obviously encrypted, secured, and HIPAA compliant, as well as the equipment and space and just the general familiarity of the clinic space is important. So we don't have our therapists doing all of this from home right now. That may happen at some point, but right now we're having everything occur within the confines of the clinic space. The visit is initiated, as you can see here. The patient will be notified once they're set up. They'll be notified by either text or through their email that they have an appointment, and they can click on the link. This does not need any app download. The patient will click on these links and they'll be taken straight to a Chrome-based environment. So everything will happen over the internet, obviously, but there's no downloading of any apps or anything like that, which what we've heard from a lot of other providers is that that is in fact happening. So this makes it much easier to get onto the system. When the patient gets on, they'll initially be sitting there waiting and waiting for their appointment. And the provider will come into the room and then they'll initiate the visit. I would then click next as a patient there and be taken to a screen here, which then allows me to pinpoint the origin of my symptoms. So if I've got a knee problem or a shoulder problem or back problem, I can move that dot around, and I'll then be taken to a screen where the therapist on the other end is then actually reviewing my information. So I've already submitted my medical history and my intake. So the therapist is able to fully review that information in a HIPAA compliant environment, integrated with our full electronic medical record program before the visit is initiated. Once the visit is initiated, then this is the interface that you'll see, and you'll see that the patient will be over here on this side and the therapist will be over here on this side. And if you look at this, for those of you who are familiar with the medical record system, you'll see that what we have here is a complete electronic medical record format. So the documentation can occur as it goes, and we have procedures in place to be able to upload the information from this system directly into our electronic medical record system. So that obviously has a lot of obvious advantages, because it means that our coding and our insurance will be done seamlessly. It ties into our documentation system, our billing system, and obviously our contractual systems too. So from the external looking in, it's as though a normal visit had happened, with the exception that the visit will be coded a little bit differently with a modifier on the end to show that it was a televisit. The other reason that that's important is that this then allows the therapist to function in their normal environment. So we're used to having a section here where we can look at the overview and look at the medical history and the patient's goals. We can then perform a normal subjective examination where we'd ask questions about their diagnosis, their pain patterns, their functional restrictions. We can then perform a normal objective examination with tools built in to measure strength and range of motion, as well as the ability to capture videos for functional movements. We'll then do a normal assessment and a normal plan. This is something that differentiates the physio product that we use from virtually every other platform out there, and certainly takes the place of Zoom and Microsoft Teams and some of these other Connect platforms. So I do want to emphasize again that this is a legitimate telehealth platform that's tightly integrated as an electronic medical record provider and tied into our systems. The patient then will be able to see exactly, once we get to the exercise platform, we've got a very deep exercise library there, and we can affect the duration, we can affect the rest periods, the number of exercises, we can develop templates for the patients. We can also give them very specific notifications about when they need to do their home exercise programs, how often they need to do it. And we can actually record the home exercise programs too, which on the work comp side particularly can be important if we need to record sessions to be able to show patient adherence, or if we need to look at what the patient's doing so we can see how well and how effectively they're doing their exercise programs. That's important as well. You can see here an example of the patient videos that they'll see, and then the patient is able to actually watch the videos being performed. So there's very good, close individual contact so that patients can understand exactly how things are working. Once that evaluation period is complete, then the patient will then be able to indicate some feedback. So they can say there were problems, they can get on the phone and talk about them, or the session was good. And then they can record a feedback video. So the patient and the therapist can both record those feedback videos, so that there's the ability for the patient and therapist to talk back and forth. This view that you see here is a view of what the patient actually gets. So when I prescribe the home exercise program as a physical therapist, that will generate this email that goes out to the patient, and they'll be able to click on that blue button there to begin their exercise, and that will take them into the platform. It will take them through the videos and show them how to do it. One of my favorite features of this exercise program, it's not so much illustrated here, but the people who are the models for the videos in this platform tend to look much more like normal people. As I said, maybe not completely with this image, but there's a lot of just normal people in there, which we know has a much more positive effect on people. It's much more difficult to do exercises as a normal Joe when you're watching a 23-year-old supermodel with virtually no healthcare problems do these exercises with ease. So that is one of the nice features of these. So it's very detailed in taking patients through the programs that we ask them to do. This, as we go through a more revisit orientation, you can see here that there is a very deep library here. We have the ability to target this by body part, understanding that all of the videos are already prepackaged. We don't have to make these as we go along, but there's extensive text-based alternatives to be able to change these around as we need to do it. So you can see now here's where a program's actually being put together, and you can see that this has happened in the plan piece after the assessment's been completed. And this is, we've decided the duration, the number of exercises, the rest periods. We can save them as a template. We can determine the frequency, the number of sessions we're going to do, and the options to record. You can see very specific exercises here, all placed in order, and we can play those videos on command. We can drag and drop, change the orders, move them out. So this allows us to do something which is very important if you're looking at the idea of actually being able to produce high quality outcomes. What a lot of these off-the-shelf programs do is provide just a block exercise program. Here's the exercises, go and do them, and good luck with that. What's really important as you're trying to move towards good outcomes is the ability to, A, make sure that every exercise that you're given is tailored specifically to that individual, whether it's a tall person or a short person, what range of motion you need to get, how long the overpressure is maintained. We can be very specific about that. It's also important that that exercise program is changed regularly. There should be some change made every time the patient comes back for a visit, whether that's as simple as increasing the duration, increasing the frequency, increasing the reps, or increasing the weight, or changing the range of motion that the patient walks through the joint, or removing exercises that are now considered too easy, or adding exercises that make things a little bit harder. The patients who do better with their long-term functional outcomes are the patients who get that one-on-one, very specific, individualized care. So again, we can go through, and it's a very similar view to what we've seen before. And then once the session is wrapped up, there's a sequence of things that we go through as we start a new visit. And that status check is extremely important for each of the patients, because we've got the subjective, the objective, the assessment, and the plan going through it. We have that period and that documentation built in to check on the symptoms since their last visit, to check on their compliance with the home exercise program, to make sure that the program we've got is appropriate and not too easy or not too hard. We'll review the exercise program specifically, as I've just said. We'll progress it. We'll take things out, add things in, and make sure the difficulty is appropriate. Again, to make sure we can continue to aggressively progress that program, because we know that aggressively progressive programs are much more likely to produce a positive outcome. One of the other things that this allows us to do as well is the additional education piece. It's very important to talk to patients about their not only their diagnosis, but also their prognosis. The prognosis is just simply our best guess at what the eventual outcome will be with the designed program in mind. It allows us to continually talk to the patient about that milestone, and it also allows us to look at some of their functional progressions. So we can watch them perform a task that they need to perform at work. We can measure joint angles. We can put in some tags to make sure they're continually getting to that. We can show them how to modify certain activities that maybe they shouldn't be doing now, or we can tell them to take some activities out or put some activities in. So that interaction part of the visit is extremely important. It's not all just about dropping exercise platforms in there. And also the repetitive nature of the visits allows us to make sure they know what's coming next, to give them an overview of how the program's progressing, an overview of how they're relating towards their goals, and an overview of how physical therapy can continue to push that envelope into the end. So just a little reminder there that we are in 25 states across the nation with our worksite solutions there in our clinics. And, you know, that's probably the end of the presentation there. But just to finish up, I'd just like to, again, thank you for the opportunity to come and speak about this product. And I do think, I firmly believe that telehealth and tele-PT in particular is here to stay. Tele-PT can provide a very, very high quality evaluation and management visit. One of the things that excites me the most is the ability to blend care. So to mix the on-site visits with the telehealth visits so we can maximize convenience and get the right care in the right place at the right time at a fair cost to make sure that everybody wins out of this and we can start decreasing healthcare costs. So with that, I'll stop and be happy to take any questions if anybody has them.
Awesome, Brett. Thank you very much. I do just have a few questions for you. First and foremost, if an employer wanted to promote this program to their employees, how would an employee go about engaging and taking advantage of a program like this?
Well, engaging with us is we do offer direct contracting abilities, or we do offer the ability to offer this program outside or in conjunction with the patient's or the employer's particular plans. We have a pretty sophisticated program in place with marketing materials and collateral materials to help the employer make this increase awareness with their patient population. And we also have the ability to do, especially if it's a relatively constrained geographically employer, we have the ability to come on site and do lunch and learns and those types of things. So we do have a pretty good program aimed at increasing awareness of the program for the employer and their employees.
Perfect. So we've examined it in the state of Michigan, for example. ATI is in network with Priority Health, in network with Blue Cross Blue Shield, for example. If you're not in network and an employer is self-funded and has a flexible administrator, you can direct contracts, so you'd have that in-network status. And if I'm an employee that had been getting physical therapy up into the coronavirus crisis, and now I want to continue that virtually, would I go to the ATI website, or how would I go about setting up my first appointment?
At this point, going through, if we do develop an arrangement with an employer, we will give them a specific interface, which will allow them to connect directly either to a clinic, or we've got a scheduling option on our website, which will create a request for appointment, and then we'll trigger somebody calling them back within 24 hours to get them scheduled at a time that's convenient for them.
Perfect. And the last question then is, you mentioned when the claim is submitted to a claims payer, a Priority Health, a Blue Cross, or TPA for that matter, there's an additional modifier code that comes in with the claim to designate that it was a virtual visit. And so one thing that needs to be confirmed before you would want to promote this to employees is to make sure that your particular health plan covers virtual physical therapy in addition to traditional physical therapy, correct?
That is correct. There is a modifier that we attach. I believe it's a -95 modifier, if I'm not mistaken, and that will travel all the way through our EMR with the documentation so that everything is complete. And although I can obviously never speak to every single circumstances, we are getting really good cooperation from a lot of commercial payers now as to their ability to help us cover these in the same way that they would cover a visit. And it's a little bit fuzzy with Medicare yet, but the commercial payers seem to be really cooperating with us right now, and we hope that goes into the future.
Perfect. Brett, this has been very helpful. We appreciate your time very much today. Thank you.
You are very welcome. Thank you.